This is a video assignment of the appendicular skeleton. In the pectoral girdle, we have the clavicle or the collarbone, and it has two ends, an acromial end and a sternal end. And then we proceed to discuss the scapula or the shoulder blade, which can be seen better in a posterior angle in this skeleton. We have the coracoid process, subscapular fossa, glenoid cavity is this here, spine, acromion, supraspinous fossa and infraspinous fossa, sternoclavicular joint, and the acromioclavicular joint. Moving along, we are going to discuss the arm, and the humerus is the upper arm. We have the head, the greater tubercle and the lesser tubercle. Deltoid tuberosity, which will be seen as a protrusion in this area. Medial epicondyle and lateral epicondyle. The coronoid fossa is this part here. And what goes here is the coronoid process of the ulna during flexion, capitulum, and it articulates with the head of the radius, the trochlea, and it articulates with the trochlear notch of the ulna, and the olecranon fossa, which can be seen at the back. The olecranon fossa, and what goes here is the olecranon of the ulna during extension. Moving forward, we proceed to the forearm, and we have the ulna, this bone here, the olecranon of the ulna, coronoid process, and the styloid process. We have the radius, is this bone here, the head, the radial tuberosity, and the styloid process. The carpus. On this angle in the proximal row, we can see the scaphoid, lunate, triquetrial, and pisiform. And in the next row or the distal row, we will see the trapezium, trapezoid, capitate, and the hamate. And which bone form the wrist joint with what forearm bone? It's the carpus. And these are the metacarpals and the phalanges. The pelvic girdle, we can see the coxal bones. And this is the acetabellum. Pubic symphysis is the center here. Obturator foramen are this hollow space here. The iliac crest. The anterior superior iliac spine. The iliac fossa. The greater sciatic notch is here or here, where you can see it better. The ischial spine and the ischial tuberosity. We proceed to the femur. This is the head, the greater trochanter and the lesser trochanter, the adductor tubercle, medial epicondyle, lateral epicondyle, medial condyle and lateral condyle, and the patella. We proceed to the tibia, which is this bone. We have the medial condyle and the lateral condyle, medial malleolus, proximal tibiofibular joint, and the distal tibulofibular joint. This is the fibia, and we have the head and the lateral malleolus. From this view, you will see the talus. Calcaneus is the heel, and the talus articulate with the calcaneus, the cuboid, navicular, medial, intermediate, and lateral cuneiform bones. Metatarsals, phalanges, and the hallux, which is the big toe.